Okay, we are rolling. Dr. Melissa Sell, welcome to the Terrain Theory Podcast.
Hi, guys. Thanks for having me.
Dr. Melissa, let's jump right into the deep end. What are the 5 biological laws of German New Medicine?
Okay, so in order to jump into the 5 biological laws, we kind of have to know Dr. Hamer's story a little bit, which is this German medical doctor who, he was the youngest medical doctor licensed in Germany. In his time, he had several patents, like medical patents on a scalpel, all sorts of different patents. And, so he worked as a medical doctor. He made money off of his patents and treated patients for free. And one day, his daughter and his son went off on this trip. To the Isle of Cavallo, and there was this crazy incident that occurred where the Crown Prince of Italy shot a gun. He was on a boat. He was kind of had gone a little crazy, got mad at these kids on this boat, shot this gun, and the gun went through, the bullet went through the wall of the boat, and Dirk Hamer, 17-year-old Dirk Hamer, was sleeping on this boat, and he got hit by this this bullet that just was flying. And he, was airlifted to the hospital. They're trying to do all these things to try to keep him alive. His leg was amputated. It was like this huge, big, dramatic thing involving the royal family. It was like extremely, publicized. And there's actually a documentary about it if people want to like learn more about like the circumstance, called "The King Who Never Was," where basically he admits to doing it and then he retracts and said he didn't do it. It's totally crazy. But in the aftermath of all of that, Dr. Dirk Hamer did not make it. He survived for a few months and he ended up dying in his father's arms. And after that, Dr. Hamer developed testicular cancer. And he just had an intuitive knowing that this huge, dramatic, emotional event, the loss of his son, and this cancer had to be connected in some way. And then in 1981, he was working as the head of an oncology unit in Bavaria. And he had an opportunity to kind of, a lot of cancer patients where he could ask questions. Did you have a shocking traumatic event prior to your testicular cancer, prior to your colon cancer? And so he found that every time, absolutely yes, there was always a shocking life event prior to the development of the cancer. But beyond that, he saw a pattern that every man with testicular cancer specifically had a loss conflict. They lost someone important to them, like a child, a loved one, a pet. Every woman who had a glandular breast cancer had some type of very intense worry for a family member, worry in the home. Everyone with lung cancer had a death fright shock where they thought they were going to die. Everyone with liver cancer had some type of starvation conflict. Everyone with colon cancer had some type of ugly, indigestible situation in their life. And so this pattern began to emerge through these connections he was making. And he started actually having dreams of his son where Dirk Hamer would be like, yes, you're getting it. There's more for you to discover. And so he was really, he said he went weak in the knees as he's like realizing that he's seeing some type of pattern in nature, that something happens, something shocking of a specific nature happens, and there are changes in the organ, a cancer. And so, so something's happening in the person's mental, emotional, psyche experience, something's happening in the organ. Then he thought, okay, there's got to be something in the brain as the conduit center for the outside and the inside world. And so he started to analyze CT brain scans. And on the brain scans, he could see there are these circles, a little ring, you drop a pebble in a pond. It's like a ring formation in the brain in a very specific location. And so it was always correlated, the type of shock, the circle impact in the brain, the organ change, the cancer. And it wasn't just one time, it wasn't just a couple of times, it wasn't just a correlation, it was every single time. Every time there was a cancer of a specific nature, there was an impact in a specific region of the brain. And when you talk to the person, they experienced a specific type of shock. And so that became the first biological law, the iron rule of cancer, which is the psyche brain organ connection, that when an organism is caught off guard, something highly acute, dramatic, unexpected, you weren't anticipating it, caught you on the wrong foot, and you felt totally isolated in this moment. So it exceeds your threshold for what you can handle and address in that moment. What happens is the biology activates a significant biological special program. So this is an inborn, innate adaptive capacity. So the psyche, so this is not the conscious mind. This isn't, oh, I thought about it and I'm really sad that my son died, so my body's going to make cancer now. No, it's the psyche. So the part that is running all of your organs, the autonomic nervous system that's just keeping everything going, analyzes the details, the felt sensation of that experience. It's experiential. So again, it's not cognitive, it's not thought-based, it's not language-based, because animals, babies, fetuses in the womb can experience biological conflict shocks because they have a felt sense of something that happens. It exceeds their threshold to dissipate and handle it. And so basically the biology activates an adaptive process, a cascade of tissue adaptations that occurs in order to help the organism to survive that situation or to reproduce. A lot of the biological programs are around how do we enhance the body's ability to reproduce, because it's all about the game of life. It's all about the ability to keep the species going. And so that's what he discovered, is that, whoa, every time a person has a cancer, we have to trace back to something in their life that was shocking, unexpected, caught them off guard, and caused their body to begin this adaptation. And then he at first he thought it was just applies to cancer, but he went on to see that this applies to a pimple, to a hemorrhoid, to a cold sore, all of these organs, and you look at the different tissue types that the body is built out of, and the tissue type is what is going to tell you what the tissue does during the conflict, which is actually the third biological law, which is the ontogenetic system of cancer and cancer equivalents, which is basically what does the tissue do and how does it do it. And so the third biological law is, if you look at this map, there's a map behind me with yellow, orange, and red. And so he went and looked at embryology. He looked at the origin of all of the tissues of the body, because he saw that certain cancers behaved in certain ways and other ones behaved in other ways. And so he had to trace it back to what's the embryological origin of the tissue. And so we've got the endoderm, the mesoderm, and the ectoderm. Functionally, it's broken into four because the mesoderm has an old portion and a new portion which behave in different ways. So the old mesoderm, or the oldest tissue in the body, is the endoderm, the yellow. And this is controlled by the brainstem. And if you think about like the most basic organism possible, what does it do? It's not concerned about its image. It's not concerned about connection with community. All it's concerned about is consuming food, processing that food, digesting it, eliminating the waste, and reproducing, and breathing. It's just like it breathes in some way, it eats in some way, and it reproduces in some way. So those are the basic functions of the endodermal tissue. So this is our digestive tract, is the endodermal tissues, all the glandular tissues in the body, anything that produces juices or absorbs juices, that's the endodermal tissues. And so these tissues, when you have this conflict, there is growth, there's proliferation of extra cells, extra tissue, so that tissue is enhanced in its capacity to do what it does. There's a great story that illustrates this, of a mother who's, her child is sitting next to her, and he's been really, he's like 3 or 4 years old. He's really into coins. And so every time, they go somewhere and there's coins involved, he's like, oh, can I, hold on to these coins? And he goes, oh, mommy, the penny's in my belly. And mom's like, conflict shock, caught off guard, unexpected. And, she's like, oh my gosh, she's like, that was a big coin that I gave you. Where is it stuck? She's like, is it stuck in his esophagus? So she's all worried that it's like stuck somewhere. And so her biology, because we can have conflicts on behalf of someone else, her biology immediately started to proliferate additional tissue in her salivary glands on the left side, because the left side is about eliminating the morsel. And so she started hypersalivating on the left side of her mouth when her son swallowed this penny. And she continued to have the conflict until it was safely out the other end, because that's when she knew that it was lubricated sufficiently. It was able to get out. But that is how sensitive and specific the deep innate wisdom of the body is that it can activate a biological special program. The body's like, I've got a program for that. And the way the body does it is it changes the tissue at the tissue level. It can grow. All it can do for us is to grow extra cells, erode cells, or eliminate function. Those are the three changes that can happen when the biological program is activated. And again, it depends on the specific nature of the conflicting event, and which tissue is going to best facilitate the resolution of the conflict. So you can see it's like there's such deep, profound, specific meaning in the symptoms that we develop. So old brain, it's about developing more tissue to better absorb, better digest. If there's a colon tumor, there was something you could not digest. And so the colon can build extra tissue to produce more digestive juices so you can better digest that thing or better to absorb that thing. In the pancreas, in the thyroid gland, the parotid gland, all these different glands, they each have their own signature for what causes them to be the one that activates. And it's amazing how specific it is to the exact dynamic of the situation that you encountered. Like, for example, the pancreas is often an inheritance conflict where you expected a certain inheritance. You were expecting to have this thing you'd already planned on having. You'd already digested it in your mind. And then that inheritance is, it's caught up in court for years and years, or, someone did something with the will and something crazy happened and you no longer have it. So often, if anyone's got a pancreas issue, look at the inheritance stuff, because it is, and it's uncanny, but Dr. Hamer, he was, in his ability, he really was able to see the unique and innate signature of nature in all of these programs. And so that's what it always is about. What is nature telling us? What is nature deeming is important in this scenario in order for you to facilitate the resolution? And so that's the yellow group. And again, there's always an impact in the brainstem, in a specific area that controls that specific organ, whether it's on the right side, the left side, depending on whether it was about acquiring the morsel or eliminating the morsel. The exactitude and the specificity of this map is mind-boggling. And that was one of the things that when I, kind of dove into this world, I was like, hold the phone. This is the most detailed map for understanding the body. I was very offended that I went to, paid a lot of money to go to chiropractic school, which the first half of chiropractic school is like medical school. You learn all of the ologies, you study cadavers, you do all of this. Never was any of this mentioned. And so, it's absolutely egregious that this isn't taught in every medical school, because Dr. Hamer in 1981, when he discovered this, he submitted his thesis October 4th, I believe, 1981, to the University of Tübingen to say, look at this, look at what I found. They would not look at it. And allegedly, they actually are paying a fine every year because they refuse to look at this, legitimately submitted thesis, but they will not look at it, because if they do, as soon as this is entered into the official catalog of things we've looked at, and we start actually looking at it, everything changes. It's an absolute reformation. It's Martin Luther all over. It changes everything about how we practice medicine, about how we treat people, and you can see the applications. When this actually is accepted, we can utilize medical care in such brilliant and amazing ways, knowing this map, because there's still necessity for surgeries at times, because these conflicts can go on for years and years and years. If you have an indigestible morsel conflict because of something you can't digest, something horrible in your family, something that happened, we always have to go back into the family structure, because that's where the root of a lot of these conflicts, most every conflict, begins somewhere in the family, in the ancestry, in the line, what's going on with this family. And there are times we have conflicts for years and the tissue proliferates beyond, a point where a surgery might be necessary. So that's getting into the beginnings of the third biological law. We've got the old mesoderm, which also behaves similarly to the endoderm. I don't know if you want me to pause or if you guys want to interject at
No,
any point.
please.
Should I
No,
keep going?
please. Let's continue through the laws, and then we'll.
So I could just keep going.
I
So the
know.
old mesoderm, this is now we have a different layer. And so this is now the protective layer of the body. So we've got the endodermal tissue. The next layer is the old mesoderm, controlled from the cerebellum. And so this layer is now all about protection. And if you look at the deep layers of the body, we have the dermis, so the deeper layer of skin, the pleura, the pericardium, these thick protective coatings around our organs are all about protection. And so the conflict theme is feeling attacked or feeling soiled, dirtied, defiled in some way. So when you feel attacked or you feel soiled, the dermis, or that deep layer of tissue, old mesodermal tissue, again, will proliferate. So we have more tissue during the conflict. And makes sense. It's to protect you. And so if someone's developed a melanoma, for example, we always have to ask, how did you feel attacked, or how did you feel defiled or soiled with someone? Where is the melanoma also? Because the location will reveal more details about it. If it's on your back right shoulder and you are a right-handed person, how did you feel attacked by a partner, by someone who wasn't your mother or your child? Because the dominant side of the body is associated with the partner biologically, and the non-dominant side is associated with mother-child. And so if someone has a symptom and they are right-handed, it shows up on their left side, where unless it was localized, like unless you actually somebody hit you with a baseball in the shoulder, that would be a very obvious localized reason that you could feel attacked right here. But if it shows up here and there wasn't a localized injury or attack to that specific location, we know that it has to do with your mother-child relationship. So did your child say something nasty to you that really made you feel attacked or hurt? Or did your mother talk to your aunts to you behind your back? She said something nasty about you. And so we can decode based on the symptom, based on the tissue type, based on the location of the body, what happened in your life prior to this symptom popping up. And it's like, how did my body determine I needed this adaptation? And so you can think of it like a little shield. We grow extra cells in order to create this little shield. If someone has a diagnosis, for example, they get diagnosed with breast cancer, they could feel an attack against their chest, and that would cause their pleura of the protective coating around the lungs to proliferate and get really thick. And that's often a complication that people experience when they've had some type of lung diagnosis or breast diagnosis, that they start having pleural effusion. So fluid in the pleural space that builds up, that creates pressure and makes it hard to breathe. And, the conventional doctor says, oh, well, it's metastasis, or your body's just spreading this cancer around. Absolutely not. Metastasis is a theory that's never been proven. It's actually an additional conflict shock that the person experienced after being diagnosed with, oh gosh, I'm being attacked, or I might have to have a surgery, I might have to have my breast removed. When you have a fear of being attacked against, an organ, we have, again, proliferation during the active conflict. And for both of these, so for the endodermal and the old mesodermal, that's during the conflict active phase. So now we have to talk a little bit about the second biological law, which is the law of two phases. And so the way the law of two phases works is, when you're in a state of ease, when you're in a normotonia, during the day, the body is more sympathetic active, so we can fight and flight and hunt and gather, and we have more active energy. And then in the evening, the body shifts towards more parasympathetic dominance, vagotonia, where we're resting, digesting, feed, and breed. That's the normal day-night rhythm. Now, when we have a conflict shock, so when this thing happens and we're caught off guard and it's more than we can handle, the body shifts into a state of heightened sympathicotonia. So we're kind of in this heightened fight or flight, and there are symptoms that you can tell I'm in a conflict, which is so important. For this is an individual system. Like, everyone needs to know this for themselves. This isn't something that somebody outside of you tells you about. You start learning about this so you can pay attention. When I'm in conflict, my hands are cold, my feet are cold, my appetite's down, I have compulsive thinking, my mind keeps going back to that thing, that situation, which is functional. So if you are constantly having, worried thoughts about a situation, it's not that worried thoughts are bad. A lot of people will kind of misinterpret this map to mean like, oh, negative thoughts are bad, and if you just think positive thoughts, you'll be healthy. It's not like that. The worried thoughts, the compulsive thinking, is an indication of an unresolved biological conflict in your life that you need to identify and resolve. And when you resolve the conflict, the thoughts, which are basically a symptom of the unresolved conflict, will go away, because you no longer need the compulsive thinking to try to figure out how to solve the conflict. Also, if you're waking up at like 3 a.m., some people just like wake up at the same time every night and they're like, oh, I just have to pee. No, you probably have a conflict that's active, that your psyche is like, hello, wake up, it's quiet now. find a way out of this, find a way to solve this. And so the psyche wakes you up, you're not eating, your appetite's down. This is where people start to lose weight when they're in a chronic conflict. If they're having difficulty keeping weight on, it's because it takes a lot of energy to run these programs. And so that's another thing that can be happening during this time. And so you're in the conflict. So again, depending on what type of conflict was it a morsel conflict? I can't digest this. Was this an attack conflict? I'm feeling soiled. I'm feeling defiled. So when you're in the conflict, you're in this heightened sympathetic active phase, and there's tissue changes. So in this case, it's tissue proliferation. We're growing extra tissue for protection or for producing more juices, and that persists until the conflict finds a resolution, until you breathe a sigh of relief. Oh, everything's going to be okay. The money came through. The court case is over. Oh, what a relief. I talked with that person. We cleared the air about the nasty things they said about me. Okay, so we move from sympathetic active conflict. What am I going to do about this to resolution? And so now we shift from this cold sympathetic phase into the warm parasympathetic phase, the vagotonia. This is where most people are like, oh, I'm feeling sick now. Because so there are some conflicts where you get a lot of symptoms during the conflict active phase, but for the most part, you're pretty asymptomatic, except for the things I mentioned of compulsive thinking, not eating very much, and cold hands, and waking up at night, insomnia. But now when you move into the what we call the healing phase, which is the restoration phase, which basically whatever happened during the conflict, we now have to set it back to pre-conflict settings. And so we grew extra tissue. For these examples I've been giving of the old mesoderm and the endoderm, we grew extra tissue during the conflict. And now we need to decompose that tissue. We need to break it down. And so the body has helpers that do this job. And this is the fourth biological law, which is the ontogenetic system of microbes. And so microbes are our helpers. They are microsurgeons. They hang out, and there are specific microbes that do not cross germ layers. There are specific microbes that only work in the endodermal tissues, that only work in the old mesodermal tissues. It's like, these are our guys. These are our, our workers. Our microsurgeons work in this layer only. So like tubercular bacteria, for example, works in the old brain endodermal tissues, and it will decompose. So just like in the woods, we have, bacteria and microbes and fungus that break things down. Tubercular bacteria, it's a mycobacteria. So it's like part fungus, part bacteria, and it decomposes, it eats up what is no longer necessary. And so the body, again, it's producing. So when conventional medicine says, oh, cancer cells are different than regular cells. Well, yeah, they are temporary in this case. So these are temporary tissues that were built, and so they have a signature. They have a specific signature so that the microbes know, decompose these ones, not those ones. It makes perfect sense. It's like, so these are the ones that get broken down. And so anytime you have a symptom where there's pus, where there's a funky odor, where there's discharge, you had an old brain conflict. You had one of these tissues that proliferated during the conflict, and now is being broken down. And so any kind of funky breath, funky smell in your ear, funky body odor, funky bowel odor, all of these things indicate bacterial activity, which means you successfully resolved something. And now the conflict is in the healing phase. It's decomposing. There's always swelling. So you might have a headache, because we have to heal at all three levels. Everything is always taking place at the level of the psyche, brain, and organ. And so in the brain, there's swelling. So that area where we had that sharp ring formation on the CT scan, once you shift into the healing phase, that area fills with fluid because it's going through this healing process. And if you have the unfortunate encounter with an MRI machine or a scan, and they look at your brain when you are in the healing phase of one of these conflicts, they'll say, oh my God, you have a brain tumor. Mm. You don't have a brain tumor. You have a tissue that's in repair, and there's fluid that's lighting up in this area because you have gone through a healing phase. And that's why, testing, you have to be very cautious with the testing that you go in for, because if they snapshot you at the wrong moment, they will see tissues in the state of doing something, in the state of decomposing or building up. And they'll say, oh no, you've got an especially aggressive whatever, and slap a label on it, get you freaked out, which will initiate a ton more conflicts. And that's typically what people are dealing with. So when someone has a conventional diagnosis, you kind of know, okay, buckle up, because this, even just a modern woman who feels her breasts and says, oh gosh, I think there's a lump there, immediately, before even having a formal diagnosis, she can activate a starvation conflict, an attack conflict, a death fright conflict, a all of these self-devaluation conflicts, just by feeling it, because we have a bad concept. We have a poor understanding, a misunderstanding of what is an intentional way that the body is trying to help you. If your child was injured in a car accident, and they're having a surgery, and you're like so worried about their well-being, you don't know if they're going to be okay, that whole time your biology is in conflict. You're not sleeping, and your body is, because we have to think in the ancient sense. Hundreds, thousands of years ago, there wasn't emergency rooms. There wasn't ability to access hydration at any moment. You were on the plane. Your child was bleeding out because of an animal bit it, and you're like, what? The biology says I can produce more breast gland tissue, so we can produce more breast milk, so this child might have a chance of making it. Like, that is how specific, and again, ancient. It doesn't make any sense today. Oh, the child is being cared for, by the best hospital in town. My breast gland doesn't need to produce extra milk for the child. That's not practical. But our bodies are ancient. And we have this modern world that we live in, but we are navigating in these anciently wise bodies that are adapted to a completely different environment. And so we always have to look at it from the ancient perspective, from how would this be helpful in nature. And it builds up during the conflict. And once your child is okay, and this is, again, you can't think, and people again will kind of get it a little twisted. Oh, you can just think your way out of cancer, or if she just thought better. No, this is a biological adaptation, that if your child is in that state, you're going to be worried about them, and the breast is going to activate that program until there's a resolution, which is either, okay, my child has passed away and I need to learn, I've got to accept that, or they're okay and now my body no longer needs this extra tissue. And so the length of time we're in the conflict matters tremendously, because if you're in the conflict for 2 weeks, that's going to be about a 2-week healing phase. If you're in the conflict for like 2 years, it's going to be like a 2-year healing phase. You got to, there's always there. And that's another amazing thing about this map, is it's mathematical. You can see that there's mathematical certainty to this, in the same way that there's math in nature, there's math in biology. This map gives us the math of biology, of how exactly it works. The conflict active phase, the resolution, halfway through. And so we're going back to the second biological law. Halfway through the healing phase, there's something called the epicrisis, which is a big squeeze. And so, we get into this parasympathetic, we're swollen, we're tired, we're exhausted, because this was heightened activity during the conflict. Now we're in heightened rest. And so we're exhausted, we're tired, we're swollen. All healing happens in a fluid environment. So anytime you're swollen, so this is where inflammation is not, and I come from my background with chiropractic and with just understanding holistic health. I used to think inflammation is the bad guy. Inflammation means I ate too much sugar. Inflammation means that I did something that I'm kind of being punished for now. I ate something bad. I was exposed to something, and now my body is inflamed, and I just need to get rid of this inflammation. Inflammation is healing. Inflammation, there's always fluid healing environment. We've got this milieu of bacteria that's doing a job to set that tissue back to how it's supposed to be. That warmth, that fever is facilitating the perfect environment for the microbes that need to go to work in that particular tissue layer. And so that's what's happening when you are, quote, sick. Oh, I'm sick. Sick means bad. Sick means something's wrong with me. And you are far from that. You are restoring, you are repairing. Your body is in the active act of regenerating your tissue back to normal homeostasis settings, homodynamic settings of this is how we want to get it back to this. But we were in a conflict for a period of time. And so now we are in restoration. And so halfway through, when you get to the point of greatest swelling, and you can also see the math of the biological laws, we see it in music, you also see it in the birthing process. And so when the woman gets to the point of maximum swelling, maximum fluid, okay, this is all we can handle here, and now we need a big squeeze. And so there's a surge of sympathetic activity. So basically, when you had the conflict, you go through, you resolve the conflict, you're in this healing phase. At the point of deepest vagotonia, often it happens at like 3 or 4 in the morning. There's a big surge, and so you almost can dream and like relive the conflict because you need a surge of sympathetic dominance. And so this is when a person will have a heart attack or a seizure or a coughing fit or some type of kind of like big health event. That's the epicrisis. And again, if you don't understand this map, if you're not expecting, I'm going to have a seizure. I know I had a feeling stuck conflict, a motor conflict where my muscles went paralyzed, and we see this even with animals. What happens is they play dead and they're frozen until the predator passes, and then they get up and they shake. The shaking, that is the seizing, that is the body coming back online. That's the epicrisis. And so, and again, if you just observe nature long enough, you will see these laws prove themselves every time. If you observe yourself, if you observe nature long enough, all of this is not a theory. You see, these are the biological laws of nature. So this big squeeze happens, and this squeezes the fluid out of the brain, out of the organ involved. You'll go through a urinary phase. And so if you're peeing more frequently, that means we're releasing that fluid. We're letting it go because we needed it during the healing phase A. Now we're releasing it. And then there's continued healing in phase B. So you might still have a fever. You might still have, some of the symptoms of the healing phase, but that is going to, you're going to persist with that until the healing is complete. And then you completed the biological special program, the law of 2 phases. And so the tissue is broken down if that's what needs to happen. Now, the other side. So these ones, remember, we had tissue growth, then tissue decomposition. The other tissues. Next, we have the new mesodermal tissue, which is controlled from the cerebral medulla. And so we have a different theme now. So we had basic survival functions. We had feeling attacked, feeling soiled. Now we have self-devaluation. And so this is all about self-esteem. This is your structure. This is your value. So your bones, your connective tissues, when you devalue yourself, when you feel broken, when you feel not strong enough, not smart enough, not a good enough wife or husband or athlete or, person, I feel bad about myself, there's decomposition. So rather than buildup, we have now tissue breakdown. During the conflict active phase, there are holes in the lymphatic system. There's holes in the bones. There's breakdown of the tissue depending on how severe. So the lighter self-devaluations where it's not as severe will hit the bursa or the fat tissue. The more moderate will go to the lymphatics, but the most severe goes to the bone. So the most severe, and think about the language we use. I felt it in my bones. I wanted to bite his head off. I cannot stomach this. I can't swallow this. I want to spit this out. That language, these experiential things came before the language. And so the language comes out of the experience. And so it, again, deeply, deeply meaningful. I didn't want to hear that. I needed to block that out. So if someone is dealing with tinnitus, ringing, what did you not want to hear? What did you want to block out? What sound didn't you want to hear? Deep meaning in absolutely every symptom. So self-devaluation, tissue breakdown, followed by tissue restoration during the healing phase. And so the biological program for the bones and connective tissue, the purpose is served after we complete the program. Because if they say if you break a bone, that bone becomes the strongest one in your body. After you devalue yourself, that tissue becomes more robust, bigger, stronger. So lymph nodes. So if I'm devaluing myself and my lymph node breaks down during the conflict active phase, afterwards, it's going to be bigger. It's going to be more robust, better capable. Because in nature, a bigger joint, a bigger lymph node is better than a smaller one. And so if the messaging that, again, my ancient biocomputer says, she's not feeling smart enough. She's not feeling strong enough. And the body says, make her bones stronger, make her lymphatics stronger. How do we do that? We first break down the tissue and then we build it up from the inside out. And then once the program is over, your tissues are thicker and stronger and more robust. You know how people, if they've had a lot of issues over the years, they say people shrink. Well, what happens is there's breakdown of the tissue and then it becomes more dense and harder. And so we have tissue breakdown. It's like the tissue melts, it gets closer together, and then it reinforces from the inside out. So yes, we may lose height, but we're gaining strength at that local area. And so that's how these tissues operate. It's also called the luxury group. This is where like the testicles and the ovaries. If you lose a child, if you have a loss conflict, think about how much sense that makes. You lose your offspring. Your biology, knows exactly what happened. Loss offspring. What do we need to do? Enhance reproductive organs, enhance the testicles, make the testicles bigger. So a testicular cyst, ovarian cysts are gifts from nature that make you more manly or more feminine, that make you better able to procreate, better able to replace whatever was lost. And so, conventional medicine says, oh my goodness, you have a tumor in your testicles, you have a tumor in your ovaries. Oh, good thing we caught it. Let's cut these organs out because they're trying to kill you. When
Mm.
exactly the opposite is true, because the fifth biological law is the meaningfulness of everything. It's the quintessence, is that nature doesn't do anything by mistake. It doesn't make mistakes. It doesn't do things that are random. It only does what is necessary to survive this moment and to procreate. Survive and procreate, because the game of life is about living. It's about keeping the game going. And so every program has this deep biological meaning. And so the testicles, the ovaries will enhance themselves following a loss conflict, making you more fertile, more able to procreate, which again is so heartbreaking for women who, get diagnosed with they had a loss. Let's say they had a miscarriage. They desperately want a child. So they're in this state of, desperation, conflict about this loss that they had. They're worried they're not going to be able to procreate. And then if they get diagnosed with ovarian cancer and they say, well, we just have to do a complete hysterectomy, we just have to take it all because this evil cancer in your body is just going to take over. And so she's now lost all her chances.
Mm.
The thing she wanted, which was, the baby that was lost, which nature was trying to. And the degree of her, quote, cancer, the size of it indicates the intensity of the loss, of the conflict that she experienced. And so conventional says, well, this is a very aggressive and very scary, and we got to save your life. Sorry, you might not have a uterus, but, we're at least going to save your life. And, and she's like left without this thing that again was there to help her, which is just the most, evil is not what's in the body. It's this misunderstanding.
Mm.
It's this way that we're looking at the body as broken and erroneous rather than deeply wise and doing exactly what it needs to do. Okay, so we've made it to the last germ layer, which is the ectoderm. And so this one is the most recently developed in our organismic history, controlled from the cerebral cortex. And now we have community. Now we have hierarchy. So this is about our hierarchy in the tribe, in the pack, and it's about closeness, touch, separation. And so the ectodermal tissues, the squamous epithelia, think about the outer skin. So the outer skin, what does it do? It interfaces. It's how we touch one another. And so when we have a separation, when we have someone being torn from us, if a baby is separated from its mother, it has this desperate feeling of this is the worst thing ever. The worst thing ever for an infant is to be separated from its mother. And so the tissue at that area, so where the baby touches the mother, the sensory cortex, there's going to be an activation of a biological special program, and there's erosion. So we lose tissue in the ectodermal tissues during the active conflict. And so in the outer skin, it's about numbing the area. You know how they say cats, if the cat loses its kittens, she forgets them. She forgets that they exist. It's a biological program of nature. There's memory loss. So people who deal with memory loss, dementia, little kids, and they say, oh, this child's ADD, they just forget everything. They have a separation conflict, and
Mm.
their biology is helping them to forget the one that they are missing. And so if your kid can't remember to bring their homework, at school, they miss you desperately. They are experiencing a separation conflict. And so that part of that program is memory loss, short-term memory loss. And so anybody who's dealing with memory stuff, we have to look at separation conflicts, rashy conditions, psoriasis, eczema. And so again, we're looking at the specifics of where is it showing up. If it's on the left side and they're right-handed, it's a mother thing. I'm missing my mother. Often little kids, where do they get the eczema? It's on the inside of the elbows and the backs of the knees. And you look like little koala babies, and how do they hold on? Where are the touch points? This is where they touch. This is where the contact is. And when that contact is lost, that's when there's numbing of the skin in that area, loss of tissue, followed by, oh, I'm home again. And so if the child is chronically having these rashes, we're like, why is this rash happening? When were you separated? When were you separated? And then also a lot of times moms will, especially like holistic moms, they're like, I've never been separated from my baby, but my baby's dealing with this rash. Okay, what are you? Who do you want to separate from? Because again, we can feel things vicariously for those who are closest for us, where my skin can adapt, for on behalf of my child. My child's skin can adapt on behalf of me, because especially, up to age 7, children are like in this hypnotic state, and they're like feeling and mirroring everything that's going on with you. And so, yes, the ectodermal tissues, we're looking at erosion. Also, think about ducts. So, the thyroid duct, the pancreatic duct, all these ducts that are transports. We widen during the active conflict. So the bronchial mucosa, this is, the conflict for quote COVID, it's a territorial fear conflict. So when you feel a sense of fear in your territory, a threat, an uncertainty about the safety of your environment, the bronchial mucosa, if it's normally like this, here's my bronchial mucosa. The bronchial mucosa has the ability to erode and widen. So we can open that space up, because I feel threatened in my territory. I'm going to need to funnel more oxygen so I can get out of this potentially dangerous situation. So we have erosion of the bronchial mucosa during the active conflict. And then when I'm safe, I'm home again, I start coughing, because when we have tickles and coughing in the lungs, maybe a little bit of a fever, it's that tissue. We went from the conflict active phase, tissue erosion, resolution of the conflict. Now we've got swelling. So oh my lung, little I'm coughing. We're restoring the bronchial mucosa. And so that's when those symptoms arise. It's always after a conflicting experience. And people are like, I wasn't afraid. I didn't have any fears about it. And this is where there's the superficial mind that thinks it didn't have a conflict. And then there's the body mind, the biology, the deep part, the psyche, that the symptoms reveal what the psyche felt, not what you consciously think you thought you felt, or like the thoughts that went through your head. Most people are not aware of what's going on in their head. They're very, very, very superficially aware of their own experience. And you'll see how unaware you are when you really understand the depth of this and what your symptoms are telling you about what's gone on with you. So those are the 5 biological laws.
Yeah. Thank you. And I want to let Mike jump in with a question, but before I do that, one of the things you mentioned early on really struck me, and I'm going to tell you a little story. My grandfather on my mother's side was in World War II, and he was like a 19-year-old gunner's mate in the Pacific on the PT-109, which is a very famous boat because John F. Kennedy was the skipper. This was before he became president. And this boat was made famous because it had an incident while it was on a patrol on a moonless, starless night. A Japanese destroyer came out of the darkness, out of nowhere, and cut the PT-109 in half. And this has been made into like a book and movies. My grandfather was thrown from the boat and badly injured, and a number of the crewmen were killed. But John F. Kennedy, the skipper, rounded up the survivors, amongst the wreckage, the burning wreckage, and swam them, got them all together, and swam them to a nearby island, like miles away, where they survived and were eventually rescued. But in that event, my grandfather was badly injured, like I said, and he told Kennedy's like, just leave me, I'm going to die. He didn't. He made it. He survived. But I'm gonna let you take a guess what my grandfather ended up dying from later in life. He had the death fright conflict.
Lung cancer.
Yeah.
Yeah, I mean it's makes so much sense, doesn't it? I mean that you would have a shock as huge as that. That is enormous.
Yeah.
Wow.
Yeah. Mike, I'm gonna let you chime in here.
Yeah, well, there's a few places I could jump. Where to start? Clearly, you have a completely recontextualized understanding of the big C word, cancer, right? Which really dominates so much of the culture in terms of fear and healthcare and all these how to deal with this, right? I mean, it's sort of fear trigger number one for a lot of people. But like, let's go back to Dr. Hamer for a second. Like, with the understanding that the body doesn't make mistakes, the understanding that the problem is the solution. I think I understand it. Is that okay? So he developed testicular cancer after the death of his son, and really that was just the body's way of saying, let's make more children. And so we just completely misunderstand what cancer
Hmm.
is what you're saying. And
Hmm.
then we come in, like you said, we take a snapshot at maybe the wrong time with a completely misunderstood concept of what the extra cell growth is. And we say, oh no, cut it out. But you're saying it's this is a process that your body is going through. And it's not only trying to draw your attention to the trauma that it wants resolved through a physical manifestation, but it's actually a physical process moving towards more life.
Hmm. Yes.
Like basically as simple as that.
Hmm.
And so there's really, is it fair to say that there's nothing to fear if you should develop cancer with
Yes.
with this mindset?
Yes, but it does, the timing does matter, because if you were in the conflict, it's like, if you swim out from shore a certain distance, you got to be sure you can swim back. And so when there's been a chronic conflict that's been going on for years and years and years, sometimes you've swum out too far, and there is a limitation to
Yeah.
how much, to the matter, the physical matter of the body, and how much swelling the brain can handle. Because sometimes people, and there are some conflicts where you're actually better off not resolving it. So this isn't just a blanket resolve every conflict.
Yeah.
For example, if somebody had a scare fright conflict, related to a car accident, and the scare fright, it affects the laryngeal mucosa, and so but every time they're in a car, every time they're driving a car, they're active, they're on the track. And so that's the thing, is you can have a kind of a partial resolution to a conflict where it's not fully resolved, but you can keep reactivating it with an environmental reminder. So a person has this, this scare fright conflict related to driving. And so every time they're driving, they're kind of on the track a little bit. And so they might have some changes to their voice. Their voice might, change a little bit, a little deeper. But if they ever get off that track, so if it happened 40 years ago, and you've been driving all this time, and then your eyesight is failing you or something, and they take your license away, and you're like, I can't drive anymore. If you stop driving and you stop getting on that track, then that laryngeal adaptation comes into healing. But 40 years of conflict load, if that goes into healing, the swelling in the larynx and the brain is going to be too great for you to actually survive. And so in that kind of situation, Dr. Hamer, and he could tell this by the brain scan. If by the brain scan, you would tell the person, never give up your license. Always drive, to not resolve this conflict. Same thing with a man who's had a territorial conflict related to his coronary artery. So a territorial loss conflict. This is why you hear these stories about like a man who, works hard all his life, and he just climbs the corporate ladder, and he's just like constantly, fighting at work, and he finally retires at 65, and he's just blissed out, and he's like, oh, I'm never going to have to go back there again. He resolves his territory loss conflict and dies of a heart attack on the golf course, because he went into so much healing. He's been in conflict all these years with this
Mm.
territorial conflict. He finally resolves it. And so in nature hasn't designed for us to have a pension or a retirement. Nature says if you've had a territorial loss conflict, in nature you'd always have that you wouldn't resolve something like that. You wouldn't suddenly be free from this hierarchy structure. In the hierarchy structure, it's actually super interesting. It has to do with the wolf pack, and how when you lose territory, who's the alpha, it's very interesting. But so there are situations where the cancer is an indication that, wow, I've been in conflict for a very, very long time. My body may or may not be able to sustain the healing phase that I would have to go through in order to kind of make it through this.
And that's where sort of the obvious uh, nutrition and taking care of yourself comes into play, because if your body's optimized to go through a healing crisis, then you're going to have an easier time of it, obviously.
Mm-hmm.
So, but what about and I've heard some pushback through other conversations. I mean, like Steve Falconer says, arsenic poisoning is still arsenic poisoning. Or like tinnitus is an example you cited. Like, I'm a musician. I have certainly abused my ears over the years, and I've got some amount of tinnitus. That's not I mean, I guess you could make a case. Why am I putting myself in that position where I want to go hear really loud music year after year after year? What am I trying to avoid, in a sense? Okay, I can contextualize it that way. but still, like, toxins and repetitive stress injuries in abuse are still toxins, repetitive stress injuries in abuse, correct?
Yeah, and
Like,
those are
it's like
considered,
a yes and situation, right?
yes, absolutely. It's a yes and. So there's, toxic exposures that anyone is going to respond to this toxic exposure because the body, it does not it's not compatible with the body, and so the body rejects it. Or physical injuries. So those are things, uh, poisoning, physical injury, and deficiency. Those are things that can manifest as symptoms in the body without a DHS. So the DHS, that's the Dirk Hamer syndrome, that's the conflict shock that
Yeah.
initiates this significant biological program adaptation cascade. That is its own thing. And toxins, poisoning, injury, deficiency, those exist outside of this. These are like symptoms that arise out of nowhere. But like
Yeah.
you said, it's always yes and, because if someone is dealing with something and it seems pretty clear, actually came up earlier today. If someone has a severe car accident, they have a very serious injury, the accident is an accident, which, I mean, on an energetic level, I think that there's a reason for
Sure,
the
sure, sure,
accident
sure, sure.
within the
Yep.
person's experience that manifested again. Why am I here? Why did this happen now? But in and of itself, an accident isn't the result, like a car accident isn't the result of a self-devaluation conflict directly. However, in the aftermath of being laid up for 6 months because you broke every bone in your body, would you not be experiencing some measure of self-devaluation? I can't take care of my family. I'm not able to walk. I'm not able to perform. I'm not able. So devaluation and injury are very closely related. And so it's kind of hard. You can't separate the psyche from any of these experiences at all. And so there's always going to be yes, and let's look at both things.
Wow. Yeah. Well, and again, in the people who listen to us regularly, we are always talking about the pillars of the terrain model being: are you deficient? Were you poisoned? And are you traumatized? And so this is GNM is basically really taking a good hard look at the trauma piece of that equation.
Dr. Melissa, how does one then step back through this lens and evaluate their own life and go, okay, where one, identify those conflicts, and then how do you then help that person, or how does that person help themselves resolve those conflicts?
Yep. And so first we have to know the map. So know what your symptoms are telling you about your experience. So chronic musculoskeletal pain, chronic self-devaluation, chronic gut stuff, chronic indigestible morsel, chronic skin stuff, chronic separation conflict. And we got to trace it back. When did this start? What was the first time that before that everything was fine, and then boom, we had the conflict. And so that conflicting experience, that is when the biology activated this program, and ever since then it's been running on a track. So anything that's chronic is running on a track. So there are reminders. So this is where food allergies come in, or any kind of allergy to anything, and they say, I posted something recently and someone was like, oh no, that's from nightshades. It's like, oh, nightshades can call it. It's like, well, nightshades don't cause herpes for every person. So how can, it's like if nightshades or gluten or any kind of substance causes a particular symptom for you, because sometimes, a person has gluten and their airways close. Sometimes they have diarrhea. Sometimes they have a rash. It's like, okay, that doesn't tell us anything about gluten. What it tells us is about you and the experience that you had when gluten or dairy or whatever was in your system at the moment. So it's, again, very biologically wise. If we think about the little animal down by the water hole, about to take a nice sip of water, there's a juniper bush to the right, and then a predator comes, and rushes you down, your biology is going to take a snapshot of every signature of that moment, the angle of the sun that was coming in, the smell of the juniper, like the time of the year. And so we snapshot that, and everyone knows, the most traumatic things of your life, like the song that was playing, and the smell, and the shirt that you were wearing, and the color of the kitchen. You know all of these things because your biology was like, listen, we need to watch out for this, because if the next time you smell juniper, and your biology can activate that program, that adaptation, seconds before, this thing might happen again, that's a survival strategy.
Mm.
And so allergies are simply a survival strategy that the body has developed to keep you aware of what's going on, activate biological programs. However, again, most of our chronic conflicts we have aren't because of true life or death situations. It's my parents got in a huge fight while I was eating, macaroni and cheese. And now every time I have dairy or gluten, I, can't stomach it and I have diarrhea. And it's like, oh, it's because you couldn't handle the reality of what you were dealing with, which is, your parents fighting, and the anger that was there and this, this thing you couldn't digest or process. And so a conflict is resolved when it can't happen again, or when you can laugh about it. So if and so it's this realization, and this is why people will like grow out of asthma, they'll grow out of allergies. They're like, yeah, I had it for years when I was a kid, and I just don't have it anymore. Well, a part of your psyche, and again, this isn't like a conscious thing. It can be, but often it's just life circumstances change. You graduate high school, you're off, doing your own thing. You're not in your parents' house anymore. The parents can be a huge track for children, and so if your parents are your track, once you get away from your parents and you realize there's a part of you that's like, I'm a grown up now. What happened then when I was a kid cannot happen now. Conflict resolved. And so the psyche's like, okay, we can clear that one out because we will no longer be in that situation ever again. And so, but when, like the driving thing, that one's a tough one. When people have a track around driving, even people that know GNM to the most detail, one of Dr. Hamer's, his lecturer who traveled all over Europe, lecturing for Hamer on his behalf, he had a chronic conflict because of, a near accident that he had. And he developed like an eczema on his finger, because this is like where his finger touched the steering wheel, like the exact kind of like place, like his contact point. And he couldn't get rid of it because in theory, it could happen again. This near accident situation could, so he was able to downgrade it tremendously to the point where like he, would barely get some, but it was still kind of there. So it's not about, like the person who knows this the best is not going to, it's biological. This is like your biology keeping you alive, keeping you safe. It's not an intellectual, like, oh, I'm so good and smart that I can never have a conflict. No. And this is why, even people, and this is what was really baffling and really hard for me to comprehend back in my, when I didn't have this framework and this model for understanding the people who were so healthy, who, they've been cleansing and detoxing and eating so clean for years and years and years, and then they get a diagnosis. What? That is crazy to me. Or people who, the opposite, who eat terribly, who don't give a crap about their health at all, and they never have any diseases. They die at like 101, just of, they just finally put out. And it's like, this is the only thing that makes sense about it, is that it doesn't matter if you're have the most pristine environment, the cleanest water, the cleanest everything, the best diet, you can still have a conflict shock. You can still have an unexpected thing catch you off guard, and your biology can still set off this adaptation cascade, and you could get diagnosed with something that seems, incongruous if you believe that the cause of the disease is naughty dietary choices or, bad exposure.
How do you advise a person then to be better at handling conflict? Like, how do we build up our resilience and the robustness so that the adaptation isn't maybe as drawn out or as severe?
Absolutely. And that's kind of the core of everything that I do now is teaching people how to do that through awareness. So I've got to be aware of what's going on with me. I've got to be aware that I'm in a conflict. I've got to be aware of all of the things that I'm telling myself about it. I've got to be aware of where I'm being very rigid, because if we lack, mental flexibility, the ability to just kind of like roll with the stuff that happens and respond as resourcefully as possible. If I've got very rigid ideas about myself, about my identity, about how I think my life is supposed to be, it's very hard for me to reconcile with the reality of a conflicting thing, a loss, or, a loss of a job, or, things not going my way, not getting into a certain approach. It's like, if my whole identity has been built around myself in this regard, and I see myself in this certain way, and then something, conflicting happens, if I don't have flexibility, if I can't kind of, just like, all right, remix and like, let me work that in to this life experience so I can kind of roll with it. If I can't do that, it's going to be much more difficult for me. I'm going to deal with a lot more inner struggle and resistance to the way things are. And so it really is, it's about awareness, flexibility, playfulness, again, the ability to laugh because when you can laugh about it, when you can genuinely like laugh at this situation and know that I just can't experience it in the same way again. Even if, so let's say you've been cheated on, like that's a big one for people. If like they've been cheated on and that just kind of like, sticks in their head and they've got this identity of a person who's been cheated on and they really just hold on to that and they have difficulty. So they can just keep running this program of sexual frustration or self-devaluation or feeling attacked or, all sorts of different things programs can run as a result of that. And so you've got to, even if that, because can you ever guarantee, absolutely airtight guarantee that the person you're with will never under any circumstances ever betray you? No, I mean, they can make promises and you can, believe them to, the maximum capacity that's available, but they're a human. You know what I mean? And you can't control what they're going to do. You can't and so it's kind of this like learning to not need to control external circumstances in order to know that I'll be able to kind of man my internal ship. And so it's all about this awareness, flexibility, learning to respond resourcefully is really one of the core skills that we teach. My partner and I in our programs, it's all about that. It's like, now that we know this map, now that we know that these are the root sources of the health issues, how do I navigate in here? How do I clarify? Do I have an organized framework for understanding how I create my perception and my experience? Because if it's disorganized and if it's just random, it's really difficult to get a handle on it. So we have, all of our programs are about like, let's organize our internal experience so I know where this particular sensation of self-devaluation is coming from. And it doesn't just feel like, oh, I'm just, not good enough and I just don't feel good about myself. It's like, no, I know exactly the story. I know exactly the thread of thought that leads me to this devastating experience that my biology is saying, whoa, we need to reinforce and make your tissues stronger.
When you are dealing with people with clients, it's not, you're just hearing stories. Like it's almost like a talk therapy, right? You have to understand thoroughly this person's history.
Totally. Yeah. I mean, I love it. It's so fun. I mean, every time I have a call with someone, it's like, all right, tell me your symptoms. It's like, "Duh, duh, duh. All right. Okay. What happened? Who were you like? Who were you separated from? What couldn't you digest? What, and every single time. And that was, this map, once I started seeing it on myself, for me, a huge one was acne. So like acne was something I dealt with all through high school, all through my 20s. And I was in my holistic, chiropractic world. I was like, oh yes, the solution is to cut these foods out and to not eat, inflammatory foods. And it's to, build my gut bacteria and eat more sauerkraut. And I was like, every single time I was like, I've got it. This is the solution. Even before that, it was if I just wash my face with enough antibacterial soap, I can just kill all the bacteria and I won't get acne. No, everything was a failure. Even when I did the 80-10-10 diet, clean, all fruit, and I was like, oh, that's going to be the thing. It's all these, foods that I shouldn't be eating. And I still would have breakouts despite doing all of the things. And it was only when this piece came in of acne is a response of the sebaceous glands in the skin, in the dermis, in that deep layer of skin that responds to feeling attacked or feeling soiled. Boom, made perfect sense. When I felt soiled so the more I learned about all these foods and, seed oils and this is bad and this is inflammatory, when I would eat those foods, I would feel defiled. I would feel soiled and I would always get a breakout. My boyfriend, he would always get a breakout too. Every time we ate out at a restaurant, we'd both get acne. We'd be like, we just can't eat out anymore. And okay, even still, we don't go out of our way to eat seed oils. We don't buy them. But if we happen to be out and eat something, it doesn't cause acne anymore because I no longer have this experience of, oh, I'm kind of going to get punished for this naughty thing I'm eating. I used to think that if I ate an organic peanut butter cup, that would cause a sore throat because I had this concept, this model that sugar paralyzes the immune system. And I used to teach lectures, like I teach about GNM now. I used to teach lectures to, 200 people about how bad sugar is and how you really need to stop eating sugar because it's inflammatory, because it's paralyzing your immune system. And that's causing, allows cancer to overgrow in your body. That was my model. and that if you eat nitrates, it's damaging your DNA, and that's causing your cells to be able to grow out of control. And that's where colon cancer comes from. So I had a completely different model. And at the time, it made perfect sense to me. But now I see the holes and the flaws, because there are people who are eating processed nitrate meat that don't develop colon cancer. And there are people eating sugar that, it's like, it was an incomplete model. And now the model has more pieces to it. And so, that is, looking at all the things. We don't go out of our way to expose ourselves to these things. But once you get the map, once you start to see, oh, this is how it works. Oh, this is acne. Oh, this is, if I get in a fight with my partner, self-devaluation of my right shoulder. Oh, my shoulder, I didn't do anything. Did I hurt myself? Did I sleep on it funny? No, I devalued myself yesterday because I started a huge fight with my partner, and now I felt like crap about it. And so I was devaluing myself. Oh, I'm a bad partner was the experiential impact. And so it affects my partner side shoulder. And so once I started seeing that, and every person I've ever talked to, every person that's ever gotten on the phone with me, we've talked about their symptoms and their conflicts, always matches. It's 100%. Now, Hamer, he was a German, specific medical doctor, and he would not put it in his map if he couldn't consistently prove it every single time. Psyche, brain, organ, impact in the brain, experience. That's what the specificity of this map is, extremely reliable.
You were talking about acne and this relationship between feeling soiled because of the food you ate. But then you also mentioned that the conflict is recognized by the psyche because that's happening in the background. You're not necessarily consciously aware. So can you reconcile those two things for me? That basically you're having to train the psyche to not recognize eating the bad food as a conflict, as a conflict event, right?
Yeah, well, for years, I would eat that food and not get a breakout. So it was kind of, and this is like if you think about like pizza face, like, oh, if you
Yeah.
eat pizza, pizza is messy. Pizza is, you know what I mean? Like, so messy foods, I found that is what the connection was. It's not and so you could have the experience. So all through my childhood, we ate, cooked with vegetable oil and seed oil, and I didn't have acne directly related to that. But once I learned about it, it became a track for me. So it's like, it wasn't in and of itself. So I think that certain foods were just inherently messy. And so if I got kind of gross stuff on my face, that could cause a breakout. And I could, think, oh, this is dietary. I shouldn't be eating bad pizza because it causes pizza face. It causes acne. But no, it's like a messy food that you can feel kind of greasy and gross. But the whole seed oil thing didn't come till later. So after I learned a ton about nutrition and kind of had all of these concepts, then I developed acne in response. So it was like, and so that's where I had to unlearn and kind of realize that it's not the food, it's the experience of feeling soiled that creates the adaptation. And so, and it's always circumstance. You have to look at the specific circumstance of the breakout. What was going on? Was it something that I had like a split energy about, or is it a track where my biology? So let's say you have a track around something, you don't have to have the thought, oh, this is bad for me in order to get the breakout. You know
Sure.
what I mean? And so that's where it's a track. The body has already registered it. But it can be a little bit of both going on. I had split energy. If you get stomach aches or like, oh, I can't digest this. If you ever bite into something and you're like, ooh, was that, this is an interesting thing too, where people are like, oh, undercooked chicken. Oh, it's got, it's because of the salmonella. That's why I get sick. And it's like, is that why you get sick? Or do you bite into something and see that it's pink or it's a bad texture? And you're like, ooh, I don't like this texture. And then you look at it and you assign, oh, it's the bacteria in the chicken. People eat raw chicken. They eat raw meat all the time. And they don't, and so it's not a one-to-one that the bacteria causes the thing. And bacteria are always the scapegoat because yes, they are present at the site of healing because they're there doing their job. They're assisting in the breakdown process. And so, there's so many kind of like nuances to understanding one individual's experience of why does this substance cause this reaction? Is the substance just a track, or is there some type of, split energy I'm having while I'm consuming the thing? That's always a huge thing. A lot of split energy people have about like, oh, I shouldn't be eating this, or I don't really, that was another, actually one of my first experiences. I was standing in the kitchen at my family, extended family's house, and they're Italian, and they had some meatballs, and I assumed that they were like handmade, homemade meatballs, and they offered me some, and so like I'm just standing in the kitchen, I start eating it, and I was like really grossed out by the texture because I'm like, this is like a Costco frozen meatball, and that is just not my jam, and so, but I'm standing here, and we're just chatting, and so I swallow it, I just kind of swallow it down whole, and I don't set the bowl down. I go ahead and I eat the other one. And then after that, I had the worst, most terrible sore throat. And it lasted for, because the intensity and the duration will determine how long this, and it was very intense. And I had a scratchy throat for days and days and was coughing because in that moment, the upper 2/3 of the esophagus, if I want to spit something out or, want to choke something, swallow something down, the upper 2/3 of the esophagus can widen. And so we widen that area and then I've got to rebuild it. And so my body, in this moment of kind of split energy about eating this meatball and swallowing it down, I had to adapt. My biology is like, all right, well, let's just widen this because you're going to eat this thing, or you could spit it up. And so I experienced the worst, like sore throat that could have been considered strep throat or something, labeled with something. But it was very clearly a conflicted moment where I didn't want to eat something. I ate it anyways, and my tissues responded.
That's incredible. Yeah, watch out for those Costco meatballs. Back to the chicken. And a side note, there is a guy out there on social. I think his handle is Raw Chicken Experiment. Have you seen him? So he's on like day 60 of eating raw chicken, and he's like, his thing is day 60 of eating raw chicken till I get a tummy ache, and he's going strong. He never had a problem. But that would be, so credit to him because we've all grown up with now like a belief system, let's call it, that eating raw chicken is going to make us sick. Right. So that's the psyche thinking that this is not good for us. And then he would have so he's somehow retrained his psyche to not experience eating raw chicken as something that's going to cause an illness. And it seems
totally.
like it's maybe as simple as that.
Absolutely. Yeah.
And
And yeah,
yet,
some people have a rebellious spirit where if you say this is how something's going to affect you, they will mirror image that because they have like this inner rebellion, and it's great.
yeah, well, that
Or you
sounds
could
like,
say,
go ahead, Mike.
Ben, you could the fourth pillar that Dr. Cowan recently added is he broke free from the delusion.
Yeah. Yeah. Well, and Dr. Melissa, I say it's as simple as, but actually, and you said you had to unlearn. It seems to me like that is where the real work is done,
Mm,
is the
yeah,
unlearning.
totally.
There's
Yeah.
the especially in the sort of esoteric spiritual threads, there's the idea that all is mental, but really we're just a physical manifestation, as above so below, and I think that might be a fair way to sum up German New Medicine.
Yes, I have correlated all of the universal laws of like all is mind and correspondence and the laws of rhythm and gender. Everything can be seen in this map. And so yes, like when you get down to it, and that's where a lot of the other theories that really made sense to me at the time, I can see how they're still so rooted in materialism. We're looking for a material substance as the scapegoat, as the cause. This physical thing caused this physical problem, and it's like when you go deep into nature, you see that everything is organized light, and that light is organized mind. And so there's this universal mind, this thought substance from which all of the physical stuff manifests. And so yes, there is physical stuff that we are dealing with in the physical world, but to see that as the causative agent, to see that as first cause, is always going to lead you astray, because there's something upstream of why did I find myself exposed to this, why did I find myself eating this, why did I find myself in this situation. If we go up far enough, you'll see that it wasn't a physical thing.
Dr. Melissa, looking at, again, get back to COVID through the lens of GNM, we're all on lockdown. I mean, it's all just one big separation conflict for basically the entire world, right?
Mm-hmm.
Did
Oh, I
you
can't tell you the number of conflicts that were identified as a result of COVID. A family separation,
Mm.
mothers separated from their children, unable to see their grandchildren. After 2 years, finally resolving that. What's going on now? Tissue restoration. And now it's like, whoa, I got some weird symptoms happening. And it's like, well, what happened 2 years ago? What happened and what changed? In when the symptoms began, what changed? Oh, well, we started seeing each other again. And it's like, hello. I mean, obviously, and we think about everything, all of the things that happened during the scamdemic. A person starts having a tickle in their throat, they go to the doctor, they get labeled with something, they're scared. So this is another incredible thing Dr. Hamer discovered one of the biological programs of the old brain, the endodermal tissue. It's a water retention program. So when you feel isolated, abandoned, like a refugee, kicked out, left out, unwanted existence conflict, afraid for your life, this amazing program activates, which causes the kidney collecting tubules to close off. And so when the kidney collecting tubules close off, either completely or just to a degree, you hold on to water. And if your lungs are in healing, so remember, we're in healing, we're in the vagotonic healing phase. If you're holding on to water while any program is in healing, it's called the syndrome, which means that area blows up with fluid because you're holding on to the fluid and it goes to the area that's in healing, which is what causes, oh no, now we need, to intubate people because they can't breathe, because their lungs, because they're isolated. You put them in confinement, you put them in quarantine, you took them away, you said you can't see your family. So not only did we have a territory fear conflict that led to the bronchial adaptation, now we're holding on to water, and that's what's causing us to puff up with this water, and we create the dramatic, life-threatening circumstance by the way that we treat the situation, which is absolutely, when you see, I mean, you can get kind of conspiratorial as far as the nefarious nature of all that's going on, because it's like, this is known. This is known behind closed doors. This is known by the people at the top. They know that this exists, this map.
Mm.
And you can't help but think that there is some type of intentional orchestration behind, let's get these people really, really scared. Let's separate them from their job, from their income, from their family, from all of this. It's like, you start getting really suspicious.
Yeah, I mean, when you said that, I just had the image of Dr. Evil being like a master of German new medicine. It's like fucking ridiculous, but I think you might have hit the nail on the head, because everything was done so deliberately and so by design to create a very specific desired effect.
Mm-hmm.
Dr. Melissa, the separation shock. Can you experience this from something as simple as like a physical object?
No, so separation is always about within a living being.
Got it. But also community, right?
Yeah.
Like if I'm taken, like if I'm othered, if a person is othered, this is another thing that happened for the last 4 years. I think those of us who, lost friends and family because we just went a different way, or our minds went a different way, like we're all to some extent, like suffering that separation conflict or separation.
Well, it
Conflict.
always, and this is a very, again, nuanced approach, because everyone experiences that, if they did have a separation, in a different way. Some
Sure.
may experience it as a self-devaluation. Some may experience it as a physical separation. Some may experience it as an indigestible morsel or an identity conflict. And so the way that your kind of makeup and your personal history leads you to be in a position to experience what that shock is for you can open up many biological programs, can open up a couple, can open up none, depending on if you are pretty, solid in and of yourself and your connection to source. And it's like, all right, this is just a thing that happens, and you're very accepting and flexible of. So it's not necessary that if a situation happens, like a divorce or a death or a loss or whatever, that doesn't guarantee you're going to have this type of conflict. So you can't work it that way. You have to work it from the symptom, the experience, and that's the thing, is sometimes people will say, oh, this thing happened to me. What symptoms am I going to get? And I was like, I don't know. We don't know how your psyche perceived it until you resolve something and you start having symptoms. Then we'll know, we can work backwards from there to figure out how the psyche perceived it, but you can't really predict on the front end.
Got it. Dr. Melissa, for the listener who really wants to get into German new medicine, what are some resources you would point people to?
Yeah, I've got a great blog post on my website that lists all of the resources. So there's books, there's an organ atlas, there's obviously like the chart where, it's Dr. Hamer, everything that he put into the map. Then there's courses. So I mentioned before Helmut Pilhar. And so he was the one who traveled around Europe teaching on Dr. Hamer's behalf. He's got a 60 tutorial bundle that's recently, in the last year or so, has been translated into English. And so that I consider kind of like the essential learning for people who want to deep dive. And those can be purchased either as individual sessions, tutorials, or as the bundle. And when you get the bundle, you have a Q&A group and like a bi-monthly webinar. And so for people who are like, I want to dive in to this, I would get one of those bundles and really just start studying them. And then my programs are all about the application, so I leave like the strict, like, let's learn like Hamer's map to the Helmut tutorials. And then I am all about like the connector, like the adapter. So here's the body of knowledge. Here's the map. And this is what I do, is help you to navigate within the map. And these are thought strategies. My partner and I teach a course called Awareness School, which is all about like the structure of your perception. How do I see myself? How do I think about things? Like, what is my internal experience made of? And how can I be more chill? Like, I call, like, when people do work with me, or like, I call it chill therapy. It's like, how do we chill out about this? How do we see this in a different light, in a different framework, with more lightness, with more ease, with more like, okay, I can work with that. Like, what is it going to take to achieve that level of flexibility within your psyche, so that this thing that was just so big and so dramatic and so terrible and awful and horrible is like, okay, I can work with that. Like, that's a thing that happens to humans. That's something that I find very helpful, is like, this is a human experience. When I depersonalize it and I detach it from like the core of my identity and just like put it out there as like, this is, whether it's the most horrific abuse, obviously, like, people, and we know that people have this capacity, because there are people that have suffered horrific abuses and terrible things have happened to them. Yet they have, come out the other side like pretty well adjusted and pretty like, all right, because they've found a way of thinking about that thing and that life experience where they haven't married their identity to it for their entire lives. And so it is possible for you to see things differently. But another kind of little tidbit, and we didn't get into this yet, but Dr. Hamer also discovered the cause of mental illness. And this is, so sometimes people will be like, I should have all the cancers, I should have all the problems because I've had all those conflicts, but I don't seem to have any kind of physical ailments. It's like, well, let's look at your mental catalog of ailments, because when you have multiple conflicts that affect the opposite sides of the brain, something happens. It's called a constellation. And so if you have a conflict on the right side of your brain and then the left side of your brain, like, the vibration of the brain changes and you manifest behavioral adaptations. So people who are really super dreamy and super spiritual and super like, they live in the cloud, these people, they're just not on this planet, and they're just like, they live in a different reality, because they actually live in a different reality, because they have a flying constellation. So they had a scare fright conflict and a territorial fear conflict active in their brain at the same time. And the brain said, goodbye, I'm going to fly away from this experience. So people who are really into fantasy worlds, if they're really into, aliens, if they're really into Harry Potter, if they're really into like some type of alternative universe reality, it's because they had such a conflict that their psyche it was like, I got to get out of here. And so they change. And so something like autism is a combination of a scare fright conflict and a territorial anger conflict. And so when those two kind of lock in at the same time, the person withdraws. And they kind of build their own reality. There's hypersexuality conflicts, the nympho and the Casanova. And so people who are like hypersexual, who are like polyamorous, and see that. So they, polyamorous, they see this as a spiritual evolution. And it's like, it's a nympho constellation plus a flying constellation. And so you can see people's like preferences, their quirks, is a result of these multiple conflicts that they experience, usually very early in life. And that, tells us so much about what else, all the things that were going on with them. So again, like, the depth of this and the implications for understanding, I mean, it's absolutely wild. So like, even, when we look at the transgender stuff and sexuality, this explains homosexuality, this explains transgender, because the hormone levels are determined by the temporal lobes in the cerebral cortex. And so when a right-handed girl has a sexual conflict, when she sees anything of a sexual nature that's shocking to her, obviously obvious things like abuse, or things even like walking in on your parents, or seeing pornography, or, an exam at the doctor, you have the sexual shock, her estrogen will go down and her testosterone will go up, and she will become tomboyish. And depending on how severe and intense that was, she could become, completely like, I don't even feel like a girl anymore, because that sexual conflict was so intense. And so, that is what we're dealing with, is this depth of knowledge that helps us to understand like everything about human and animal experiences.
Would you recommend talk therapy to a person who might just be stuck in that conflict? Like, for example, you speak of a girl who had this sort of conflict and then developed imbalances, but has retained that. Like, would you? What is the way the way forward for that person?
So they definitely need to, I mean, like traditional talk therapy, because it's not rooted in this model. Talk in circles. Talk in circles. We're not looking at understanding it. Again, a lot of these conflicts that happen very early in life, we're not necessarily like, how do you, if somebody flashes you at a parking lot, like how do you resolve, like how do I unsee that? So there are conflicts again that we're not going to be resolving. We're going to be learning how to navigate within the constellation,
Yeah.
which is why, I mean, my thing is every practitioner of every discipline needs this map. We need all the chiropractors, all the psychologists, all the psychiatrists, all of the acupuncturists, all the naturopaths, all the everyone, and that's why I get kind of like miffed with some of the holistic people who like, I know you know this map, but I know that you're not speaking in terms of this map, which is just one of those things where it's like, this is the law of nature. This is the root, the basis of, there's not a better map that I've seen. Show it to me. If someone out there is like, I have a better map, show it to me, because this is the one that I see as most consistent, most accurate, most detailed, down to the tissue level, embryological germ layer. Nothing else describes that. When I hear people talking about health conditions, but they don't talk about the germ layer, I'm like, you're missing a piece. You're not giving us the full story. Perhaps either you don't know the full story, or you're hedging around the full story, or you're just like, everyone needs this map, because it is what's going to help the talk therapist help her toolbox so that she actually knows how to assist a person. If you don't know the biological reason for this person's adaptation, you cannot assist them maximally, because and a lot of times that's the thing, as often in our attempts to help a person, again, if you don't get the details and the understanding of the psyche, you're trying to take something from them that's actually a deep protective mechanism, which is why, again, we stay on that hamster wheel. We keep going back for the same thing. It's because I'm not recognizing the deep biological wisdom in this thing that I think is a problem. And so there's, multi levels, many layers to the depth of this understanding. And so simple talk therapy, you might feel supported by it, and so in that sense it might be really nice for you, because yes, people do resolve conflicts in talk therapy, because when you just come out of isolation and you're like, you finally talk about that thing that you never talked about, that can induce a resolution. And so for that reason, it's not like it's got zero benefit. However, it could have much, much, much more benefit if the practitioner understood the biological implications for what the person was dealing with.
That makes perfect sense. It's context. It's providing the important context. And as Mike would say, like getting out of delusion. We can't be delusional about why we're in this position in the first place. Dr. Melissa, I feel like we could spend hours more on this, and I know you could, because you are steeped in this, but we don't have all the time in the world. So unfortunately, we're going to bring this plane in for a landing. And we do that with a question that we ask all of our guests. Excited to bring this back to terrain. Well, we've been in the terrain, but what are your non-negotiables, the daily habits that you do to tend to your terrain?
Oh man, I play with my cows. I get outside every day. I have 2 cows, 2 dogs, chickens, and ducks, and so it's being in nature, in like on the land, touching the animals, loving on the animals, and so that's a non-negotiable. Reading, journaling, really just like rooting and connecting to source. I mean, that's kind of the biggest one, is realizing what's real and what's just a fabrication of the distractible ego mind that wants to jump into a million directions. And so it's staying rooted in that. I mean, I love spring water. All the natural holistic things that I did before have carried over in my life, as far as how I eat and how I like the products that I buy, but that's just no longer like the biggest part of my focus. My biggest part of my focus is peace, physical movement, and nature.
Beautiful. And Dr. Melissa, where can the listener learn more about you and your work?
Yeah, drmelissasallet.com. I've got a YouTube channel that has a lot of videos, both like kind of practical tutorials on German new medicine, as well as kind of my application and how I work it and how I help people. I've got a whole, library of courses that help people. Tomorrow night, we're doing a self-evaluation course. Next month, I'm doing a class all about STDs from the German New Medicine perspective. So there's always stuff going on in my world. And yeah, I've got a class called The Language of Adaptation. It meets every Monday at 11 Pacific time. And so it's a 90-minute class where if you want to, a place to talk about this stuff. And, we're currently going through all the way, every tissue, every germ layer through the whole entire scientific chart. We're, in the endoderm now. And so that's just a great place to really just like dive deep into this. You've got 70 weeks of classes that you can go back into and revisit. And so there's a lot of resources. And like I said, that blog post will direct you to, things outside of my world so you can kind of get to the source material.
Got it. And we'll put those links in the show notes. Dr. Melissa Sell, thank you so much for joining us on the Terrain Theory podcast.
Yeah, thank you guys for having me. This is a great chat.
All right, folks, it's the after party in the Pineal Room. Dr. Miranda.
Dr. Hardy, hello.
Dr. Melissa.
Yeah, wow, that was long overdue. Although it also felt like the perfect timing, like the new terrain that we were ready to get into.
Yeah, we did. We are ready, and it's interesting. The timing is perfect because for a number of reasons. But when we did the Alec Zek water fast episode,
yeah,
he posted a clip of that to social, and it was me talking about the rash that I got.
Right.
And in that clip, I mentioned all the things that were going on in my life at the time, like separated, moving, and all these folks in the comments. It was like 5 or 6 comments, like, separation conflict, skin rash, GNM. You should be looking up GNM. I'm like, okay, it can't be more in your face than that. And when I look back at that time, I'm gonna have to do a little more examining, as I imagine you will, of like your current condition, like physical condition. But it makes a lot of sense. And what I want to know too is what I want to try to look back at that actual moment where like the rash started on my leg. What happened like right before that? But I also I feel like I have enough understanding to look at that separation. You separate from your wife, like that is a separation conflict. And then at the same time, you think about, I'm kind of separating from my son at times. Like every week I have days when I'm with him, and then I separate from him and I don't see him.
Yeah.
Like that's happening that's an ongoing separation conflict. Maybe. I mean, I would love
I would say definitely.
Definitely.
I would say definitely. Also, you were trying to separate yourself from the state you were living in.
So separating from my community. I mean, COVID had already kind of you separate from your community. I was thinking around the same time, feeling separated from the game of soccer because I had injured my Achilles. So all of a sudden you have this community, these brothers that you're playing with, like twice a week, just like you with hockey. And that's taken away from me like cold turkey. I don't know. Now this just gives me a new lens through which I can examine things that are happening in my life, like physically. And it does not feel out there. It feels like it makes a lot of sense.
It allows you to give a lot more respect to your emotional life. And not, I think, as like, men, the cliche is just to sort of grin and bear it and slough it off and soldier through and all the right. But it's gonna get you if you don't own up to some of this basic common sense emotional reality. Yeah.
Yeah, and I like that there is a empowering aspect to it, in that you can start to train yourself to be a little more resilient, to be a little more flexible, to be less attached with the way things are right now, and better equipped to handle a sudden conflict.
Yeah.
And adapt. I mean, it's really just about adaptability, isn't that? I mean, we all subscribe to that, right? We all believe in adaptability, that the strong adapt and survive is the saying. And so those who are better able to adapt to these situations are the ones who are going to survive and thrive. So how do we build like that resiliency and that adaptability. And part of it is just like mental flexibility. I'm going to take everything as it comes. And I love too that she just boils it down to like, teach people how to be more chill. Yeah,
Yeah.
that kind of makes a lot of sense.
Yeah. And, you know, because it's when you're just learning about a new subject, you tend to like paint with broad strokes, but like you look at like the Buddhist monk who's like seems like unflappable and just doesn't suffer because they're just elevated or more connected to source or just chill.
That was the other thing that she mentioned a couple times, which you bring up here, is connection to source. How important is it to have this connection to source? It's sort of the touchstone, in order to better resolve conflict when it happens.
Yeah.
Seems like it's pretty important. So let me ask you something, because we've talked about a number of times now in the after party, your left shoulder.
Yeah.
How would you look at that now through GNM lens?
Well, it's a great question. I think she said the left side is like mother child separation.
The non-dominant side is like a mother child conflict.
Yeah. Now, and can that be extrapolated to, is it specifically my mother, or is it just like the relationship with the mother of my children? Or, you know, that is a question I guess I have. Or my wife as the mother of my children. And then I still have to sort of untangle the reality of just the repetitive stress injury, which is what
Sure.
seems completely valid as well.
Can be accounted for as well.
Yeah. And I think that's the point Steve Falconer was saying. It's like, yes, it answers a lot of questions, but arsenic poisoning is arsenic poisoning. A repetitive stress injury is a repetitive stress injury, right?
Well,
These aren't mysteries. Like this shoulder injury doesn't seem like a mystery. It was actually very directly related to overuse and discomfort from. But maybe that's just a story I tell myself. Right?
Perhaps, yeah. Well, I think it bears investigating now. Why wouldn't you look at it now and do a self-evaluation and go, well, could it be could it have been something?
Yeah.
And what could it have been? Can you trace this back to the beginning and go, what was happening around that time? What I do feel really good about coming out of this conversation is satisfied. I'm satisfied with the answer that she gave to the question, how does this fit in with toxic exposure or deficiency / malnutrition? And it does. I mean, this is the stress, right? What really makes us ill? Stress. Well, where does stress come from? It comes from a conflict.
Yeah. And your body's ability to sort of meet the healing crisis and deal with it.
Yeah.
Right? But it does seem, if there's a pecking order, it does seem to be like she was saying, like, and we've even talked about, you can drink all the yummiest spring water in the world and eat organic, but if it's almost secondary to getting like your mental health in tip top shape. Like it can support that, but it doesn't work the other way around.
Mm-hmm. Do you think that there's a place for certain substances?
What type of substances?
I don't know. I think about like mind altering substances, even something as simple as THC.
Yeah.
Which can just put you in a different frame of mind to maybe just better handle conflict.
Absolutely.
What about alcohol?
Yeah, maybe so. Maybe so. Used with like, less recreationally, but like more deliberate. Yeah, certainly. Especially if you can release the guilt and fear around, oh, I'm drinking poison. I mean, that's a big part of
it's that unlearning that is going to be the most daunting challenge ahead of me.
Yeah.
Because I think every time I put a tortilla chip to my lips, Michael, and I know that it's got the sunflower oil or whatever's on it, I'm thinking that it's there whether I'm consciously thinking it or not. Yeah, seed oils, what's this going to do to me? And I've got to get over that.
I think so. I've also noticed since I've post water fast, and I've like really gone with the inverted food pyramid approach, and it feels really good and all that. Like I've released the guilt around eating some chocolate. You know, where like I've said in the past, I'd like to do things cold turkey, like get sugar out, but like, and I'm enjoying it more, and I feel like I've not earned it, but because this carnivore leaning diet is really feels right, that it feels like, well, that feels right too. Whereas when I was a little unsure of what I should be eating or what felt right, everything was on sort of a shaky foundation. And she also sort of helped me recontextualize the gluten thing. And she provided more nuance because I've always, not always, but for a long time thought, well, it's not so much the gluten as the glyphosate.
Mm-hmm.
But your body, how do I put this? It's like when she used the example of the small creature drinking from a stream by the juniper bush, and then the predator comes, and now the creature associates junipers with a fearful moment. Well, it's like, how many times was I enjoying a beer on the road and it was like glyphosate central, but I didn't know that, and like that's the almost like that's the predator, and so now my body's like, oh, there's some shit that you're consuming that I don't want in here, and it just is going to associate the glyphosate poisoning every time I look at a beer. You know what I mean?
Interesting.
I mean, it just sort of broadened the focus on the allergy idea, and that it's not necessarily the quote unquote gluten. It might be the toxins therein. But even if the toxin therein isn't present, it can still trigger the allergy.
Sure. It becomes very almost circular, doesn't it?
Yeah.
Like the toxic event happening in your body is the conflict that consciously you're not even aware of, but your body is aware of it. And so it's triggering the psyche. And now that association is made.
Yeah. So it was a really deep, I mean, it was that conversation was like nuance central. We're always talking about nuance, but it's like, yeah, there's layers to this stuff, and it really does make sense. And again, it's yes and. Willie, you want to come in? Say hi. Come on in. What's up?
Willie's in the pineal room.
It's just me and Ben. Yeah, Willie. We've never had a guest in the pineal room. What's up?
Willie's going to join us.
Do you want to hear my dilemma?
Sure, lay it on us.
Okay, well, I don't think we're going to be able to reuse this.
Hold on, he's got to get on the microphone. We'll get up to the mic. Speak into the mic, right into it.
Yeah.
I don't think we're going to be able to reuse this litter box.
Oh, okay. Why is that? Is it just
it's oil?
Well, I asked you if you could maybe clean it with some soap.
I tried.
Did you try again?
Believe it or not, I did that too.
Yeah.
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 Dude, I thought we had a third at some point.
I thought we had a third too. I don't know where the third went. Okay. So you're saying it's uncleanable?
I think it is. I'm saying it's not a great
idea. Could you just put some like Murphy's oil soap in there, which should be above the dryer, and some hot water, and let it soak for a while. Okay. I wanted to tell you, Ben, too. So, come here, Willie. So Willie's got these Bluetooth headphones that I don't let him use.
Yeah.
I don't let him use the Bluetooth. You can also hook up a cable to them. And I noticed he's been, you can take them. Okay. He's been wearing them to school. You know, it's early in the morning. I'm getting him on the bus, making his lunch. I'm like, and I said the other day, I was like, Will, you know, I don't like you using the Bluetooth. And here's his hustle that he's been running. Can I tell the story? You want to tell it?
Oh, I can tell it.
Yeah.
Let's hear it.
Well, so I don't use the headphone. The headphones can be wired. That's the way I use them normally. But at school, you know, of course, you can't listen to music in class. But one wouldn't think that one has a wired earbud in their sleeve if they're wearing headphones around their neck. So what I do is I take some like earbuds and I run them up my shirt and through my sleeve to my palm where I can hold it, and I can sit like this with it in my ear. And they would, because it's so stupid to have two pairs of headphones, they would never think I was listening to something.
So the ones around your neck are just like a decoy.
Exactly.
Yeah, they're for show. It's like obviously he's not listening to music because they're not
Also,
on his
don't I
ears.
look like so much cooler with these?
100%. Like
Yeah.
cool and smart. What are you listening to through that one headphone?
Well, music.
At school, what though? What are you listening to? What kind of music?
Currently, it depends. It's a lot of the Strokes, as it
Okay.
always will be. A lot of Foo Fighters.
Oh yeah.
Lots Arctic Monkeys occasionally.
Okay.
The Smiths.
Does the earbud get like taped to your palm? How are you like holding
No,
it?
it's just kind of in my sleeve.
Got it.
If someone looks at me, stares at me for a while, a teacher, I might hide it back up my sleeve.
Yeah, because
So it's
surely it's not comfortable to just be like this all class long.
No, it's not. And in which case, occasionally I will run it through my shirt and up here, where you would imagine. And the headphones serve to protect the vision of the wire.
So you'll sometimes put it in your ear,
I will.
but you'll use the big headphones as a block.
It comes through here. And, I always wear the hat too. The hat really helps. And my hair is getting longer, so that helps a lot too.
You are learning all the essential skills at school.
And now you are learning all the essential skills if you decide to go back to school.
Even if I don't,
any
I can just employ this in public and feel like I'm winning somehow. Well done, Will.
Thank you.
And isn't it also the Defender Shield earbuds that I got you for Christmas?
Occasionally.
Yeah.
Yes.
So, way to go, Will. Win-win.
Win-win.
Yep. Yep. All right. Good luck with the.
Maybe we can find another one.
Oh yeah, we can. Yeah, it's not a big deal. I just figure we try. Yep. We can also. Did you move the oil into the oil pan? We could drop that off at like stage 1 or someone, or even I think like AutoZone.
Like you pour it in, and like it's in there.
Is it?
It's also all on top.
So it's still a mess.
Yeah.
That will it eventually sort of drain in?
It will always still kind of be there. Clean it really well with oil.
Yeah. All right. We'll figure that out. So maybe not before we go to Florida. Okay. Okay. All right. We'll get another litter box tub. Thank you, Will. Yeah, still soak it. Why not?
There's a litter box for the cat.
Correct.
Okay.
Yeah.
And you have 2 already, but you have 3 now total?
We have at times had, that was a hot tip we got from Vern, is even if you only have 1 cat, to have multiple litter boxes, and it just sort of spreads out the waste,
Yeah.
It just doesn't accumulate in one so quickly.
Right. But okay. That logic doesn't hold up completely because it's not like the cat poops less.
No.
It just means that when you do end up cleaning, you're cleaning 4 full litter boxes rather than 1.
Yeah, kinda. But it 1 fills up and gets gross pretty quickly.
Okay.
And so it does make it somehow. I know that the math doesn't make sense like on paper, but in reality, it does seem more manageable.
Yeah. Yeah. And it's let's just remind the listener that it's really important that you don't live in a world of delusion. Otherwise you'll get sick.
Well played. Way to bring it back to topic.
Yeah.
Anyway, nice to have a visit from Will. I don't know if we'll keep that, but yeah.
We'll keep part of it. Yeah. Will is schooling school is what he's doing.
Yeah. Aren't you sort of proud of him in a sense? It's like,
of course.
Yeah.
It's problem solving is what it is. I will get my way.
Yeah.
And
I love when I called him out and I was like, man, I don't like when you use those Bluetooth headphones. We had an agreement. And he's like, well, I'm just using them to listen to music with my wired headphones.
Subterfuge, just decoy.
Yeah.
Smart boy. You're raising him right, Michael.
God, I guess.
You're raising him right.
Yeah.
Well, folks, nothing you heard here should be taken as medical advice, as neither Mike nor I are medical experts. Remember that you are light, you are love, you could probably be more chill. You are your primary healthcare provider. Thanks for tuning in, and we will catch you on the next one.